Good day everyone! I am Kajer Angel Lagame Gabino, your student nurse from NUST. For today's video, I will going to perform or I will going to demonstrate how to put the NGT or we call the nasogastric tube. First is what are the assessment. First, the doctor's order. Next is the client level of consciousness and the level of knowledge and understanding. Next is the availability and the functionality of the needed material. Next is the check for the history of a nasal surgery or deviated septum. Assess the patency of the nares. Determine the presence of the gas reflux. And the last is assess the mental status or the availability to participate in the procedure. Now, let's go for the planning. First, before inserting the nasogastric tube, determine the size of the tube to be inserting and whether the tube is to be attached to the suction. Now, let's go for the prepare the equipment. First, large or small bore tube, non-allergic adhesive tape, clean gloves, water-soluble lubricant, facial tissue, glass of water and a drinking straw, 20 to 50 ml of syringe with a adapter, basin, pH test strip, stethoscope, disposable pad or towel, clamp or plug, aciflux valve, suction apparatus, safety pin and elastic band, and the CO2 detector. Now, let's go for the procedure.
Introduce yourself and verify the client identity using the agency protocol. Explain to the client what are you going to do. Assist the client to high filer position if his or her health condition permits and support the head on the pillow. Place a towel or disposable pad across the chest. Perform hand hygiene and observe appropriate infection to control the procedure. Provide the client privacy. Assess the client nearest. Prepare the tube. Support the patient during the procedure. Determine how far to insert the tube. Use the tube to mark off the distance from the tip of the client nose to the tip of the earlobe and then from the tip of the earlobe to the tip of the sipode. Mark the length with the adhesive tape if the tube does not have markings. Insert the tube. Lubricate the tip of the tube well with water-soluble lubricant or water-to-sea insertion. Insert the tube with its natural curve toward the client into the selected nostril. Ask the client to hypertense the neck and gently advise the tube toward the nasopharynx. If the client gags, stop passing the tube momentarily, have the client rest, take a few breaths, and take sip of water to calm the gag's reflux. Ascertain correct placement of the tube, aspirate stomach contact, and check the pH, which should be acidic. Confirmed by the X-ray, place a stethoscope over the client esophageal and inject the 10 to 30 ml of the air into the tube while listening a worsening sound. Secure the tube and taping into the bridge of the client nose. For the evaluation, evaluate the patient's response to the procedure and document the procedure and other important data of the client chart.